So before we hit like the actual antibiotics, what do you guys know about antibiotics? Just spitball me something. What are they? What do you know about them? Y'all
If
all
you have
taken
an
them?
infection, it kills the infection.
All right, so it kills what kind of infection?
Bacteria?
Only bacterial, right? Because there's viral infections,
Yeah.
fungal infections, right? It doesn't kill any of those. So it only works for bacteria. What else do y'all know? All of them are hard on the kidneys. You just learned that. Get it, girl. Okay, so we know that all antibiotics are hard on the kidneys, which means you got to check their kidney functions, right? Now, if it's a normal, healthy person, we're giving PO, we probably won't do that, right? But if it's an elderly person, if they have any health issues, anything like that, we're checking kidney function. And then if y'all go into the LexiComp or you go into whatever drug thing that y'all use, it'll show you. Remember, I told you that if their GFR is lower, it'll tell you how to reduce the dosages. Okay. What else do y'all know about antibiotics? What side effects they cause? Don't worry about it. It's not on your sheet. None of that. Just
Diarrhea.
all of them cause diarrhea. Why do they cause diarrhea?
Because they're hard on your stomach.
Okay, what antibiotics do?
They kill the bacteria.
Oh, where?
Oh, you
Oh,
have good
oh,
bacteria in
oh,
the stomach.
whoa, yeah. Okay, so in your gut, you have a whole microbiome. And remember, 80% of your immune system is where? In your gut. In your guts, right? Which is your intestines. So there's good bacteria in there and there's bad bacteria. And you hopefully will have more good than bad so you can have a good gut microbiome, right? But the antibiotics that you take, they don't know what's good and what's bad. So what do? They kill all of it, which is going to cause you to have diarrhea and a very poor gut health. Y'all know even one round of antibiotics can alter your gut microbiome for 2 years. It can take that long for it to get back. So it is very important if your patient's on antibiotics, I always recommend a probiotic. Okay. I only give antibiotics if I absolutely have to. And I'll always say you need to be on probiotic for a minimum of a month, but ideally I want you to be on it for a year because it's going to take you a long time to grow back that microbiome. And remember which neurotransmitters are in our guts, what are made and
Acetylcholine.
you were real confident. Which two neurotransmitters are made and absorbed in your gut?
I feel like I know this.
You do. We've talked about it. Yeah, we've talked about it a lot. Come on, everyone. Name me a neurotransmitter.
Dopamine.
Okay, well, that's one.
Yeah.
Okay, so one of them is dopamine. And what is your keyword for dopamine? Pleasure and reward. Okay. So what's the other one? Serotonin. Which keyword for that one? You said it earlier.
Happy.
Yes, it's happy.
It's happy.
So that's why people that have anxiety, depression, we look at gut health. Because if you have poor gut health and your neurotransmitters are not neurotransmitting, right? Your serotonin's not being made, your dopamine's not being made. The happy will not be happy. That will lead to depression. You see what I'm saying? Okay. So it's very important that we repair that gut microbiome. So antibiotics, all hard on the kidneys is what y'all told me, right?
Yeah.
They kill bacteria only. How do you know a patient has bacteria? What is the only way to definitively diagnose a bacteria?
But your analysis? Culture.
A culture, right? Whatever it is that you're worried about having an infection, you have to culture it, right? So if you're worried that they have a UTI, you would do a urine culture. If you're worried the patient has pneumonia, you would do a pneumonia. You would do a sputum culture. If you're worried the patient has meningitis, you would do a do not say brain culture. Okay.
I just know the positive.
Oh, that is true. Okay, so ask yourself, what is meningitis?
It's,
Infection of the brain and so
spinal fluid?
yes, a CSF culture through a lumbar puncture, right? We spinal tap them, right? All right. If you're worried that the patient has sepsis, what would you do? Blood culture. Okay. So culture is the only way. So we must culture things in order to determine if somebody needs an antibiotic or not. Okay. But there may be some times that we don't have time to wait for that culture to come back. Because how long does it take cultures to come back? A few days. Like urine cultures are 2 days. Blood cultures take 5 days to come. I mean, I don't have that long. So we may start them on antibiotics before we get the culture back. What is that called? Starts with an E. We call it something. We're going to start them on antibiotics. It's not prophylactic because what are prophylaxis? That's preventing an infection. What do we do if we know they have an infection, but we're going to start them on antibiotics before we get the culture back? It's called empiric antibiotics. Empiric. So if they say like empiric antibiotic therapy, that means like, hey, I better go ahead and start them on something. If their culture is negative, we'll just take them off the antibiotics. Okay. But if the culture is positive, we've already gotten ourselves like ahead of the game. Do you understand? Do you understand?
Yes.
All right. I need somebody to come play a game with me. It's going to have to be one of the three of you. So thank you, Marie. All right. So do you want to be the antibiotic or the bacteria?
I'll be the bacteria.
Okay. So she's going to be a bacteria. We're going to just go back a little bit so they can see. All right. You're the bacteria. Come stand over here. Like right there. Okay. So she's the bacteria and I'm going to be the antibiotic. Okay. So for kabillions of years, bacteria have existed. Yes? Is it okay if I touch you during this whole thing? Okay. So bacteria have existed. All right. So all of a sudden in like the 1940s, they found out that antibiotics are a thing, right? And they accidentally found it because of mold, right? Y'all know penicillins and stuff come from mold.
Yeah.
Okay. So ever since then, it's been you, the
Bacteria.
against me,
The
what am I? I'm the antibiotic, right?
Antibiotic.
Okay, in this case, yes, so I'll be the penicillin. All right. So we've been fighting for years, right? Okay. So bacteria, they're living, breathing things, are they not?
Yes.
Are you not smart?
Yes.
You are smart. And so when somebody tries to kill you, are you just going to continue to allow somebody to kill you and all your family members? No. What are you going to do?
Fight.
That's right. So she about to fight me back. Okay. So if you look across the top on the MOA, this is how this has happened. You can grab your paper if you want to see it too.
Okay.
If you're a person that is visual and needs to see it. Okay. So you see the penicillin. The PCN means penicillin.
Okay.
Okay. So I am the antibiotic, you're the bacteria.
Okay.
So it's the 1940s, and I'm like, hey, guess what? We got penicillin, and we're going to kill all this bacteria. So all these people that were dying of infections before, they ain't going to die no more, right? Okay. So penicillin actually has what's called a beta-lactam ring. See how it looks kind of like Saturn?
Yeah.
Okay. So I am like this, okay? And my rings have knives on them. Got it? So in the 1940s, when we first discovered penicillin, I was like, and I stabbed you with my beta-lactam ring. You died. Rest in peace. Oh, very good. So she's good at this. Okay. So I kept doing that for like 20 years. And you finally were like, look, this is crap. I'm going to fight back, right? Okay. So now it's the bacteria's turn. So you want to look at step 2. So what happens is, originally what happened, penicillin was created with this beta-lactam ring. It goes up to the bacteria, stabs them, and then they rupture and they is deceased. Okay. So we did that for a long time until the bacteria realized, I can fight. Nope. I can fight back. Okay. So then we're going to go to the next step. You with me? Okay. So the penicillin, I have that this is my weapon, right? You know this is my weapon. I've been killing you with it for 20 years. So what do you think you're going to do?
Fight back.
Yeah. So you're going to take away my weapon. Oh no, it broke. Okay. So what the bacteria did was they created their own enzyme called beta-lactam ACE. What does ACE mean? It breaks down. It's an enzyme, right? So you created your own enzyme. How creepy is that? The bacteria in your body can do that. So the bacteria in the body created beta-lactamase, and the beta-lactamase got rid of my beta-lactam ring. So now I'm like, oh, I can't
kill you.
You know, and I can only do it with one side. Okay. So then whose turn is it to fight back?
The penicillin.
It's mine, right? Because she killed my beta-lactam ring, and that was my weapon, right? So what am I going to do? So if you look at the next step, what do? We created an antibiotic, penicillin, with a beta-lactamase inhibitor. So what is that doing?
That is
so now, yeah, you created this beta-lactamase that dissolved my arm or my sword, right? Yes. My ring. And so I created an enzyme inhibitor that gets rid of your enzyme, okay, so I can still and kill you. Do you understand?
Yes.
Okay. Now we're going to take it a step further too, but we're going to stop here for just right now. Do you understand how this has happened? Okay. Obviously, thank you. You did a very good job. I'm going to need you back in a minute though. Okay. So I want you oh, sorry. Let me explain this too. On each of these sheets, you will see the drug class. Okay. And then on top of the drug class, you're going to see what type of antibiotic it is. This is a beta-lactam antibiotic. What does that mean?
It kills the beta.
It had a ring. Beta-lactam is the ring.
Okay.
Okay. And that's how they kill it. Right. And then over here, on each of the sheets, you will see if they're bactericidal or if they're bacteriostatic. What does bactericidal mean? You hear cidal. It's kind of, yes, it's kind of like that. So actually, I didn't go up and stab you. I just kind of gave you the knife so you could stab yourself. So it makes the conditions where the bacteria will just like off themselves. That's what bactericidal means. It makes them so bad that the bacteria wanted to kill itself. Yes, kill itself. Okay. What do you think this one isn't bacteriostatic, but what do you think bacteriostatic is? If something is like stasis, static. Staying in place. Right. And so it doesn't kill the bacteria. If it's bacteriostatic, it doesn't kill it, but it doesn't allow it to replicate. So eventually, since they're living, breathing things, they will die off. Okay. So that's where you'll see that. And then each of these is going to have a MOA, mechanism of action. How does it work? Okay. And then it will have what are the drugs that are in this drug class.
Okay.
Then you've got the side effects, adverse effects, and your nursing care. And each one will look almost exactly like this. Got me? Okay. Now, for penicillins, it is nice because if it ends in cillin, it is a penicillin. Now, drug endings are not always reliable. I will tell you when they are, and I'll tell you when they're not. You can take this one to the bank. If it ends in cillin, it's a penicillin. Okay? Y'all with me?
Yes.
All right. So the penicillins are amoxicillin, bicillin, and ampicillin. Those are the normal beta-lactam antibiotics. They've got their ring. Okay? But remember, then the bacteria developed
Its own enzyme.
which is called
The
beta-lactamase. So then we created
The
beta-lactamase inhibitor. So these right here, the ones next to the penicillins, are the penicillin plus the BLI. That's the beta-lactam inhibitor.
Oh, okay.
So you will see the normal penicillin, amoxicillin, then they added a BLI, which is clovinic acid. You've got piperacillin, that's the penicillin, tazobactam, that's the BLI. And you will see them as a slash, like that.
What's the augmentin?
Augmentin is the brand name because I thought maybe some
Okay.
of y'all have taken Augmentin before. It's very common for like sinus infections
Okay, so
and
that's
stuff.
the brand, and then
Mhm.
this is the
Generic.
generic.
Mhm.
Okay.
So whenever these don't work, they jump into this one.
Sometimes, yes, that's a great question. So, like, let's say a kid comes into my urgent care, right? And they're like, oh my God, my ear hurts. So I'm like, well, you haven't had antibiotics in a long time. Let's try amoxicillin. Now, there's 3 bacteria that can affect the ear. Amoxicillin works on 2 out of the 3. Let's say the kid comes back 3 days later. They've been on a full 3 days, so it should have kicked in by now. Mom's like, oh my God, his ear is still hurting. He's still got fever. That tells me this bacteria probably has beta-lactamase and I need to add a BLI. So I would take him off the amoxicillin and put him on the Augmentin.
Oh, okay.
Does that make sense how we use this? Okay.
Yeah.
All right. So, oh, also DOC. I didn't tell you about DOC. Do you know what DOC means? Drug of choice. Okay, so that means that drug of choice, that penicillin is the drug of choice for which bacteria. Okay. So penicillins are used for strep. Almost everybody in here's probably had strep or strep throat at some point, right? Clostridium, not C. diff, just Clostridium. Okay, because C. diff is a whole other thing. Y'all know what Salmonella and Shigella is?
When you eat something.
The gut stuff. You
Yeah.
got bloody diarrhea. Okay, what about E. coli?
The poop.
Yep, that's also bloody diarrhea. Okay, and then Hibs. Anybody know what Hib is? Oh, you should know what Hib is.
Influenza.
Haemophilus influenza B. It is not HIV. It is not hepatitis. It is a bacteria. Okay, that's called Haemophilus influenza B. It's also not the flu. Okay, it is not for penicillins. Do not cover MRSA because what does MRSA stand for? Yeah, it's MRSA, but methicillin resistant Staph aureus.
Okay.
So it tells you in the name it's methicillin resistant. It's resistant to penicillins. So you cannot use penicillins for MRSA. It's in the name. Yeah?
Okay.
Yes? No?
Yes.
Okay. So side effects for, oh, if you look at, sorry, go back to drug of choice. It's basically anything in the throat or the gut. Because Hib causes epiglottitis, which is inflammation of your epiglottis. So y'all need to make sure you're jotting down keywords so you can help yourself remember. So this one for penicillins, it looks like throat and gut. Throat and gut. Okay. All right. Side effects. Tons of people are allergic to penicillin. Okay. Now this next thing I'm about to say is one of the most testable things you'll have in this entire course as well as NCLEX. There is a cross allergy to cephalosporins. What's a cross allergy?
That gives another allergic reaction.
Yes. So if you are allergic, a cross allergy means if you're allergic to one thing, you're probably also allergic to these things. Like I'll give you a random one. This one's crazy. Y'all heard of spina bifida before?
Yes.
All right. All of our spina bifida babies, as soon as they're born, we say that they have a latex allergy. We put them on latex precautions because they have so many medical procedures and they're exposed to it all the time. If you have a latex allergy, there is also a cross allergy to chestnuts, bananas, and avocados. It's crazy. That's what a cross allergy means. If you're allergic to one thing, you're probably allergic to these because chemically something is similar. Now, how latex is similar to a banana, I do not know, but that's where we're at. Okay. So if a patient says, I'm allergic to penicillins, what's the first question you need to ask?
Do you have any allergies?
Well, you just did.
Oh.
You said, do you have any allergies? And they said penicillin. What do you want to ask? What kind of reaction? Because if they're like, oh, I got diarrhea, what do you want to say?
Okay, that's normal.
Yeah, I'll be like, okay, that's not a side. Can I give them a cephalosporin? Yeah, because that's not really. If they said, oh man, I got hives, I couldn't breathe, and I'd be transported to the hospital, are we giving them a cephalosporin?
No.
No, because they probably have a cross allergy and they're going to get a reaction to cephalosporins as well. Okay. There is also a rash called an amoxicillin rash. It is not an allergic reaction, but some people break out in a rash. So anytime a patient's on a penicillin and they get a rash, you do have to bring them in. You have to take a look at it because a patient may not be able to determine whether it's allergic or just an amoxicillin rash. Okay. Diarrhea is a side effect of all antibiotics. We know this, right? All right. Adverse effects would be anaphylaxis. Now that's bad. Give me your big girl words for how you know someone's having an anaphylactic reaction.
They can't breathe. They're wheezing.
Big girl words. Wheezing.
Wheezing. Coughing.
You see,
Urticaria.
Yeah,
Urticaria is
urticaria.
hives.
Crying.
Pruritus is itching. Okay. So you may have wheezing. You may also have swelling around the mouth and the tongue. What's that called? Bigger word. Little close this. And the close their airway. Starts with an A. Angioedema.
Yeah.
Okay, it's angioedema. It's where they swell around the mouth or the face, and that is life-threatening. You better report that immediately. If a patient is taking high-dose Penicillin G, they can get hyperkalemia. What's your keyword for potassium?
The heart.
Heart. So you need to check an EKG. Okay. Do not mix in the same solution as aminoglycosides because it inactivates the aminoglycosides. Now, aminoglycosides we're about to cover in a minute. It's another antibiotic class. Now, they can take a penicillin and an aminoglycoside. You just can't put it in the same tube.
Okay.
Okay. Anytime you're taking penicillin, you need to take it with a full glass of water, either 1 hour before meals or 2 hours after. Now, you will hear me say all through pharmacology, take this on an empty stomach, but if it hurts your stomach, take it with food. I'll say it 100 times. Okay, I know it sounds stupid, but that's the way pharm is meant. All right, since all antibiotics are kidney toxic, we got to watch that kidney function. Okay, if they're allergic to penicillin, they should wear a med alert bracelet because God forbid they have to call 911 or they're unresponsive or they're in an MVA and then they just start them on penicillin antibiotics because they have an infection and they don't know, you could die, right?
Yeah.
If you give it IM, which Bicillin is the one that you give IM, you have to observe the patient for 30 minutes after to make sure that they don't have any kind of allergic reaction. Okay. Now go back up to adverse effects where it says challenges. What are the challenges in penicillin therapy? Well, y'all know penicillin's the first antibiotic that came out. It's been out for almost 100 years, right? So the challenges are the beta-lactamase bacteria. What did we learn about the beta-lactamase bacteria?
That's the ring.
They can kill the ring, right?
Okay,
The beta-lactamase is where the bacteria kills the ring with that enzyme.
Yes.
Okay. So the other thing that the bacteria did was they were like, I'm tired of getting killed all the time. Okay. And remember, we developed a BLI, a beta-lactam inhibitor. So then we dissolved them, right? So then it was their turn. Yes.
Yes.
Okay. So the bacteria then created something called penicillin ACE. What is ACE? An enzyme. So what do you think that enzyme does? Breaks down the penicillin. They came back fighting. The penicillin's been killing them for forever. So they created an enzyme that kills the penicillin. Isn't that crazy?
Yeah.
Okay. So then on top of that, they were like, you know what? Screw y'all again, because I'm going to create something called penicillin binding proteins, where I will chase the penicillin down. The bacteria chases the penicillin down, binds to it, and inactivates it. Isn't that shocking? Now it's our turn, but we haven't developed anything yet. So, yeah. All right. Do we understand penicillins?
Yes.